Chris here, and welcome to my channel. And today, we're gonna see what happens when you need surgery.
Rotator cuff edition.
So today, we're gonna tag along with a patient who requires surgery to see what happens.
Okay.
So the first thing we gotta do is get changed. Step one complete. Now we have to go see the patient and initiate the orders. So my hospital uses an electronic medical record, or EMR. I have to enter all the orders on the EMR first. Now that that's done, let's go see the patient. So, this is our patient. Are you ready?
I'm ready.
He looks ready.
Yeah.
We've signed consent. We've marked the appropriate limb right there, and he's good to go. Chris, tell me, what did you do to yourself, and why are you here to see me today?
Poor choice on the motocross track. Went over a jump, went too far, and went over the handlebars and landed straight on my shoulder.
Okay, and what's the injury that you suffered?
It's supraspinatus full thickness tear.
Excellent. And what are we doing for you today?
Reattaching it.
All right, giddy up. Well,
Yeah.
let's get to it. Now it's time to get the room set up. So this is known as the beach chair. And this is what we use to position patients when we're going to do shoulder surgery. So the first thing that we need to do is to get the beach chair set up. Let's do that now.
Check it.
So since we're doing a right shoulder, we're going to position the spider, which holds the arm on the right hand side. And there, you have the beach chair. Set up. Side bolsters, armrest, the spider for holding the operative arm, the pedal for controlling the spider, and the cushion for the legs once the patient is sitting in the chair. And of course, the backrest is adjustable so the patient can be intubated if necessary.
Intubation is the process of putting a breathing tube down somebody's trachea, and we do that if we're going to put somebody to sleep and we want to support their airway while we're sleeping. In Chris's case, we're not going to be putting him to sleep, so he doesn't require intubation and he doesn't require the breathing tube.
So here we have the room partially set up. Over here, we have our instruments that we're going to use for the case. We have our fluid management and our handheld resector and ablator units, which we have there. We have more fluid management.
Fluid management is the system that we use to deliver water into the joint that we're going to be operating on. Arthroscopy is a technique of using an underwater camera to look inside of a joint. So basically, we fill the joint with water, and then we make a small opening and put a camera in through that opening and look at the joint through a medium of water instead of a medium of air.
For fluid, this is for fluid going into the patient, that's for fluid coming out of the patient.
Like, gross me out the door.
Then we have all of our arthroscopy equipment on the tower over there. Over here, we're going to have set up all of our instruments that we'll be using today. That's in all of those packages, so we'll get those out once the scrub nurse is here. And then here we have some of the implants and other instruments that we'll be using. We have different types of anchors for rotator cuff repair, which is what we're going to be doing today. Also, from another vendor, we have different implants over here. We have some instruments. This is called an ablator, which we'll be using to help clean up some of the tissue that we see in there. And then some of the hand instruments that we'll be using, and some of the access portals that we'll be using during the case today. Okay, so this is our scrub tech, Steven. Got the instruments? Oh, and here's the patient. so now we have the patient position. We have the beach chair set up. How you doing, Chris?
I'm doing pretty good right now.
You ready to go?
Ready to go.
Excellent. So we're gonna get things underway very shortly. We have the patient set up in our beach chair apparatus. We have the whole draping put up. We have the arm put through the bag so that we can minimize leaking. And now we have to attach the arm holder to the spider attachment. So if I can enlist the aid of my circular nurse, Jean. Because the spider is not sterile, we have to make sure that we cover the spider with a sterile bag. So we've done that, and now we're going to connect the spider to the arm holder. Now that's connected. And we are good to go. Thank you. So here we've marked off the anatomic structure so that we know where to put our portals.
Portals are just the holes that we use to make entry into the joint. Basically, they're just small stab incisions in the skin, and then we put the camera in through those holes, and that's how we get in. So those are called portals.
So we have here the acromion, this is the clavicle, and in the front we've marked the coracoid. So here's our anterior portal. We have a lateral portal here, but we'll probably make one or two more, and then we have our posterolateral portal here as well. Giddy up. Okay. Okay, so here we are inside the shoulder. Off to the left-hand side, here's the glenoid. Off to the right-hand side, here's the femoral head. You can see in the front, although we're here to fix this up here, which is the rotator cuff tear, you can also see that he suffered a labral tear here at the front, so we're going to have to repair that.
Next on that recording.
And we have a little bit of the superior labral issue here. We could probably just debride that. We may have to put an anchor up there as well, but we can also see here his biceps tendon. That looks to be in reasonable shape. But you can see here the rotator cuff, which is retracted in the front, which should be attached over here, but it has torn and is retracted over there. So we're going to have to put that all together. And you can also see that some of the rotator cuff tissue is still intact there, but most of it is retracted over here. So we're going to have to clean this all up and put this all back together. So the first thing we'll do is start out with the labrum, which means that we're going to have to get some additional instruments. Okay. So we've seen inside the shoulder an anterior labral tear, which was right here, and then we also saw the rotator cuff. So we fixed the first half so far, and here you can see we have two anchors, one here and one here, to stabilize the anterior labrum, which was off. And then this is the base of the biceps tendon, which we've debrided and cleaned up a little bit, and now it's time to go on to the rotator cuff, which we're going to do now. So here we are, we finished the rotator cuff repair, and we've done what's called a speed bridge repair, which is sutures in an X configuration. So you can see one, if it'll stop bleeding here, one limb of sutures here, another crossed over in the middle, and then a fourth limb of sutures here in the front.
So basically, the technique that I use to repair a rotator cuff is the suture bridge technique. We use two rows of anchors, what we call a medial row and a lateral row. And in the medial row of anchors, we connect those sutures to the lateral row of anchors. And what you end up with is a X configuration of sutures. It kind of basically looks like an X of sutures. And if you're more confused, just check the picture out.
So everything's done. We're headed on the way to the recovery room now. And so the patient will be in the recovery room for about a half an hour before he goes back to day surgery. There we are in the day surgery. Let's go write some orders. Good day, how are you?
I'm good, you?
I'm outstanding.
Good.
How are you feeling?
I'm much better. The first week and a half was a little bit rough post-surgery, but now I'm starting to get some sleep again. And the shoulder isn't constantly in pain, it's only once in a while.
Okay, perfect. So we're 2 weeks, correct?
Yeah,
Or
2
thereabouts?
weeks to the day.
All right. Just out of curiosity, what position did you find comfortable to sleep in?
It was actually slightly on my back, but with my shoulder having a pillow underneath it, just kind of on a little bit of an angle. That's the only thing. I tried the couch, I tried recliner chairs, just the bed. Nothing would work for the first little bit, but now I've found this.
Okay, perfect. And you're making out okay with your sling there?
Yeah, sling's going great, super comfortable. The only thing is it's a little bit hot because it is a little bit bigger, but whatever gets the trick done, I'll do.
All right, perfect. Take a look at the wounds there, and then we'll get your stitches out.
I thought you were gonna put a hole through my tattoo. My wife was gonna be really happy about that.
I know you told me that, and I was gonna come look for her afterwards and say, I'm sorry, I couldn't do it for you. So we try not to make too many incisions, but we do make as many as is necessary to get to the area that we want to see and do our work. Typically we have this posterolateral incision right here. We have several lateral ones on the side, and then we have an anterior one. Oh wait, I got these two here. This is just kind of just to see what happens. I'm gonna get you stand up for me, and you can face us. Can you do that? No.
No.
Can you do that?
I could maybe swing it out a little bit,
but you can't lift it?
No.
Okay, good. Elbow like this, and hand out.
Oh, Jesus.
No?
No.
Okay, good.
It's gonna be a long rehab.
It tells me you've been compliant, which I like, which is good. Don't do that stuff again until I see you next time.
All right.
All right? Okay, so now we got your stitches out. We talked about what's gonna happen for the next couple of weeks, and then I'll see you, I guess, in 4 weeks from now. Just curious, so do you have any words of advice to anybody who's thinking about having this done, or anybody who's scheduled to have rotator cuff surgery done?
If you're right hand dominant like I am, practice doing things with your left for a week before you need that practice, because if you try to start getting yourself dressed without doing it, you're gonna hurt yourself even more. Having someone around to help you is definitely beneficial. And people who tell you about surgeries, it could be knee, hip, whatever, they're gonna tell you it's gonna be painful and you're not gonna sleep much, and it's difficult to get prepared for that, but you can sleep the night before, a couple days before, get your Z's in.
There you go. Thank you very much.
So after a rotator cuff surgery, recovery is typically as follows. So for the first 6 weeks, or at least for my patients in my practice, the patient will be in a sling for 6 weeks. And during that time, he's not really moving the arm other than to move the elbow a little bit during the day, and maybe some easy pendulum swings of the shoulder to avoid overall shoulder stiffness. But during that time, we're allowing the rotator cuff, which we've now repaired and reattached to the humeral head, we're allowing that rotator cuff to heal and start to attach itself to the bone. After the first 6 weeks, we then get him out of the sling and we start to work on his range of motion. And for most people, that takes sort of 4 to 6 weeks. So the first 6 weeks is immobilized. The second 6 weeks is the time over which we want to restore normal range of motion. And it's my plan or my goal for the patient to have a full range of motion of their shoulder after the 6 week period. Once they've attained the full range of motion, then they can proceed or switch gears from flexibility and range of motion to strengthening. And so that's sort of the third 6 week block. After that, we start to move to restoration of proprioception, or your body's ability to know where the arm is in space when you're not looking at it, and your ability to return to more energetic or vigorous or ballistic movements, and by that I mean sort of work tasks or sports or those kinds of things. And then usually after the completion of those 4 6 week cycles, most people are able to get back to their regular routine and do the things that they were doing before. Typically for my patients, I don't really have any restrictions for them, but I do caution them on doing overhead activities, anything above shoulder height, because those activities in that range of motion are the things that are most likely to be affected by injuries to the rotator cuff. There you have it. Hopefully you've been able to see what happens when you need surgery.
Rotator Cuff Edition.
So be sure to let us know in the comment section down below if you've had surgery and what your experience has been like. If you're new to the channel, be sure to subscribe and hit the notification bell. If you like the video, be sure to give us a big thumbs up. And as always, that's been a word from Dr. Chris, not your everyday ortho.